Professor Klein coming back at you from the gym, fitness center here at Ohio University. WellWorks. I used to work there as a personal trainer when I was a student. Awesome, awesome place to be as a personal trainer or an employee to apply your anatomy knowledge to clients who want to get in shape, who want to get stronger, and you have the knowledge to do that. So I got a special place in my heart for WellWorks, and I love that place. And the reason why I'm in WellWorks is we are getting into the muscles and movement. So we're going to talk a lot about the back movements, or the back muscles today and their movements, and how that relates to lifting and strengthening those muscles on the body. So to dive in here on the first PowerPoint slide, we can see a reminder of the words ipsilateral and contralateral. Ipsilateral meaning same side, contra meaning the opposite. So that means if a muscle turns your body to, let's say, the left, but it's being contracted on the right side, that's contralateral movement. Movement to the other side than the muscle is on. Ipsilateral is, let's say you contract the muscle on the right and you rotate to the right. That would be an ipsilateral movement. Furthermore, if you have muscles of the back on the right side and the left side, you can unilaterally contract those, which means just contracting the right side. That's one side, one, like a unicycle. And then bilaterally would be contracting both of them at the same time. So make sure you know unilateral and bilateral and what that means for the muscles. And a general rule of thumb is, as we look at some of these muscles, you're going to notice some are looking like a roof. So if it's got a roof shape and it's unilaterally contracted, it's going to perform a contralateral rotation. Again, that means you contract the muscle on the right and it contralaterally rotates you to the left. But V-shaped muscles the other way are going to do the opposite. If it's a V-shaped muscle, it's going to unilaterally contract, and you unilaterally contracted, it's going to perform an ipsilateral rotation, contract the right side, you rotate to the right. Ipsilateral rotation. So here's a shot of the back muscles. And again, there's multiple layers. So we'll talk about the superficial layers such as the trapezius, but do note this is the left trapezius. The right one has been removed. It would be right there. So with a lot of these pictures, you have to visualize that other side in there as well. We can also see things like the deltoid, the latissimus dorsi, or the lats, as well as deeper structures in here. Now, in order to see those deeper structures, we remove the muscles, and now we can see things like the rhomboids. The rhomboids are deep to the trapezius. So in order to see the rhomboids, you've got to peel back or take off the trapezius. We also can see some rotator cuff muscles. We can see the deeper erector spinae muscles. And again, here is a cut of the lats. The lats would connect from here to here, but it's been cut so that you can see the deeper level structures. All right, quick side note to the Ackland's anatomy resource. In here, we'll always want to reference these videos. As we can see, if we play this one here, it's going to show you the muscle on the cadaver. And again, this is the trapezius right here. And then it's going to remove it and show you it on the skeleton, origin, and insertion points for all these muscles. Eventually, he's going to show you the movements of the muscle on the actual human body.
Upper part contracts, it powerfully elevates the scapula.
So a great resource to use is that website. I'll be using some of those videos in exams to test you all. So if we bring it back here, we can see a few things to note before we move on. There's actually a giant form area of fascia called the thoracolumbar fascia. It's a big piece of connective tissue in the bottom of the thoracic posterior aspect of the body. And you'll notice a lot of muscles converge here. The lats converge. You get a little bit of the traps coming down, the erector spinae. So this area has to be a big connecting spot for a lot of different back muscles. And let's go even deeper. This is almost as deep as you can go, and you can start to see the vertebrae as you travel down here. And we get into the intrinsic back muscles. So extrinsic would be like the ones that we just saw on the previous slide, but the intrinsic ones, we're talking about the Transversospinalis Group, or the muscles that rotate your back. And you can see there's 3 different types right here, depending on how many vertebrae they span. Additionally, you've got the interspinalis and the intertransversarii muscles that just go vertical. So the key difference is that these up here will go from transverse process, transversio, to the spinous process of another vertebrae. So break the word down into 2 parts, and it tells you the 2 attachment places of those muscles. So here's a look at the different layers. So this is a cross section right here. And if we were to annotate the anterior versus the posterior, deep versus superficial, that's what we would do here. So the deepest ones we just had mentioned were rotators, multifiddies, semispinalis. But then we also have 3 other ones we'll get to. But then the latissimus dorsi and the traps are most extrinsic or superficial. So start to get a idea of the different layers of these muscles. Let's look at the Transversospinalis group first. And we had mentioned the 3 rotators, multifidi, supraspinalis. Now, in your book, it's going to say a range of how many vertebrae they span. But let's just make it simple and say rotator span 1, multifidi span 3, semispinalis span 5. So what that means is if we look at the rotators, you're going to have an origin on the transverse process of 1, and then the insertion on the spinous process of another. Now these are roof-shaped. So you'll notice they form, if I were to draw the other ones on the other side, a roof-like shape. So we're going from the transverse process of 1 up to the spinous process to make that roof shape. And this is where anatomy gets high volume with muscles, because we want you to know the unilateral contraction. If that occurs, it's going to produce contralateral rotation, rotate or contract the right, rotate to the left. But if you contract the right and the left at the same time, then you're going to do back extension. So it depends on the type of contraction, the action of this muscle. And finally, we'll always talk about the nerve innervation, and in this case, it's the dorsal rami of the spinal nerves at that level. And this table is a table I will give you for all muscles to summarize what's in your book. Your book is great, but sometimes it just says too much for my liking, so I summarize it in this table. The tables are the gold standard for what's expected on exams. Here's two more tables for the multifidus and the multispinalis. Nothing changes except for the fact that now we're talking about 3 or 5 instead of 1. So that's the main difference between these three muscles. All right, next up, we're talking about some deep segmental muscles. These muscles span the spinous processes or the transverse processes. So real quick, so that you can see these, I've taped them onto the vertebral column, and you can see the intertransverse muscles right here and the interspinous muscles right here, literally in between the spinous processes and in between the transverse processes. And what are these going to do? These are such small muscles. Well, now we get into the fact that some muscles have a primary function, their main function, or a secondary function, their less important function. So in this case, the interspinalis muscles have a primary function of stabilizing the vertebral column. Their secondary function is back extension. Same thing down here with the intertransversi muscles, but unilaterally they would laterally flex the trunk. Lateral flexion, instead of flexing forward, lateral flexion is bending at your waist and flexing to one side or the other. And by stabilization, they mean just keeps you upright. Posture, when you have good posture, you just are upright and you're not collapsed. That's the action of these two muscles. All right, as we keep going, we're gonna get bigger and bigger and bigger. And now we're on to what's called the spinous muscles here, the spinous capitis and the spinous cervicis. And for that, we can see that spinous refers to more the neck region. So we're up in the neck, back of the neck here, and the word capitis refers to the insertion point on the skull cap or the skull, and then spinous cervicis. So spinous cervicis, there's actually a mistake in this PowerPoint picture. You want to cross out capitis and put cervicis. Cervicis sounds like cervical. That means the muscle starts down here, but then it stops at the cervical vertebrae. It does not go to the skull cap like the spinous capitis does. The other thing to note on here are these 4 muscles down here that make up this triangular like shape in the posterior aspect of the skull. So make sure you know these 4 as they form that triangular shape in the posterior aspect of the skull. All right, here's another look at those spinous muscles, and let me just divide it for you because it kind of looks like all one muscle, but it's actually 2. So here we can see the capitis going all the way up, capitis, and then the cervicis, go CE, down here. Now they're all covered in fascia. Fascia is covering all sorts of muscles coming up from here, the thoracolumbar fascia. So a key thing that we'll get into is, after learning an origin and insertion and kind of the general setup of the anatomy, is the movement and how to strengthen these muscles. So we said typically a muscle is strengthened concentrically when you perform the action of that muscle against resistance. So as we can see, the origin and the insertion and the innervation, but now let's say we want to bilaterally contract these muscles like this individual down here in the bottom right is doing. She is taking something, and let's say at home you can take a t-shirt or a towel or anything like that, kind of wrap it around the back of your head, pull, but then resist with your neck. Now that's going to contract those cervices or those spinatus muscles and strengthen those. And if you're like me, I spend a ton of time on the computer, a ton of time on my cell phone, and my neck is kind of naturally in that flex position. So I would need those neck extensor muscles to really be strong. So oftentimes throughout the day, I'll put my hand back here, I'll push forward and then resist. And then my neck will stay up in a very straightforward, straight up position. So anatomy class is part learning the anatomy, part doing it on yourself. So let's take a minute. Let's do 3 reps together here. So stay nice and tall. Take your hand, place it on the back of your head. Do this at home here. Push your head forward. And then when you're right about here, pull back. Hold it for about 5 seconds. Shake it out. Do it again. Number 2. And then let's really get it going here. Take both hands and push straight down and then resist. And what you hopefully feel after that is that neck extension, trying to keep your head upright in a very safe position. We'll talk more about that later. All right, we're on to the back here, and we're on to what we call the erector spinae muscles. This is a huge group of muscles in the back. And as we can see, these muscles travel all the way up from the pelvis and sacrum area, all the way up to the cervical region sometimes. And we can see these are called the iliocostalis, longissimus, and spinalis. And that's from lateral to medial. So this is the most lateral all the way to the most medial. I remember it because I love spaghetti. And if you say I love spaghetti as you travel lateral to medial, you will remember those. Now I am not going to pick something in the middle of these divisions because it's very hard to see where they change, but I will ask you things like what's the most medial, what's the most lateral, or which one's in the middle. And here's another look at them with more muscles on, as well as surface anatomy. So again, if you're working with a client or you're working with somebody, you might see these long muscles coming down. It looks like 2 pillars. That's the erector spinae muscles, but you know, as an anatomy expert, that those muscles actually extend all the way up the back and all the way down to the sacrum. So even though you only see a little bit of them, let's say on a human body, you know that anatomy from this course. So if you are unilaterally contracting these, they do a little bit of lateral function or lateral flexion. And the more lateral that you go, the more lateral flexion that will occur. If you bilaterally contract them, you're going to do back extension. And again, the dorsal rami innervate these muscles. All right, so if we're in the gym and we want to do some back extensions, we might use a machine like this. Is the back extension machine. This guy's explaining it. He's got over 1 million views. He must know what he's talking about, right? Well, you always want to check the anatomy, even if they're super popular. So let's check it here. As he goes down into flexion, he comes up into extension. So that definitely would safely work the erector spinae muscles. All right, another video for you here. And as you can see, she explains it using the erector spinae.
About 2 inches. We're going to inhale as we lift up, working the muscles that line your spinal cord. These are your erector spinae. They go from the base of the neck all the way down to your pelvis. And lowering.
So she gave the quick explanation. It's from the base of your neck all the way down to your pelvis, erector spinae. She's got over 1 million views as well. And while we're talking about the back muscles, we've got to mention sprains and strains. So a sprain is dealing with a ligament that you might pull, and a strain would be more of the muscle. So you can strain your erector spinae muscles and cause a large amount of back pain. So it might be from excessive hyperextension, it might be from overloading the muscle, a lot of different causes of that, but you'll experience that back strain or the sprain of those ligaments in those areas. Now, we're not going to actually get into all the extrinsic back muscles. I just wanted to label them and kind of start to introduce them. They will be talked about later in the semester, but for now, just kind of get a general idea as we talk about the vertebral column of these extrinsic back muscles, as we can be seen listed out here. We can also talk specifically about the trapezius, just to indicate that a lot of these muscles have different All right, we're going to finish with a case study looking at extension or hyperextension. And I'm just going to set you guys up for your professional teams this week, looking at what is hyperextension. So we mentioned flexion of the trunk, which would be bending this way, and then extension coming this way. And there's an optimal range, but what is beyond optimal? What is hyperextension? And here we can see some pictures of it, where there's an extreme curve in the back versus a straight line. Now the straight line actually, again, remember, has what we call lordosis, which is a natural curvature. So beyond that natural curvature, that's when you get an exaggerated lumbar curve with an increase of injury, where we have that disc slipping forward, spondylolisthesis, super fun one to say, but that's what can occur. So by all means, we want to avoid hyperextension at all costs. But it's not as easy as it always may seem. For example, if we look here, this looks almost normal at first, but then you notice how the chest is just very far out and how the back is rounded, the glutes of the butt are kind of pushed out versus more of a straight line over here. Now, in both situations, he is lifting the weight, but the way that he does it, his form, his technique is drastically different from picture A to picture B. Same down here. Let's do picture C and picture D. Picture C, at first glance, looks like he's doing a great squat. I mean, he's parallel to the ground, knees over the toes, chest out. A lot of times you hear, get the chest out. But if we were to look at his spinal cord and his vertebrae, there'd be this unnecessary hyperextension versus this one over here, which is a straight line. Let's keep going. Now we can see things like a back bridge or a glute bridge, straight, curved. In some instances, let's say excessive bench pressing, if you are a power lifter, I know in powerlifting, it's all about how much weight you can lift and you will train in ways that you probably would never prescribe certain populations to train, because your goal is to lift the most amount of weight. So this picture down here of the bench presser, if he's going for an all-time high lift, that's great, that's fine. He can probably get some better leverage this way, but you've got to know that the lumbar vertebrae are in a very, very, very hyperextended position, which puts so much pressure on the back. So if you were to do this repeatedly, time and time again, it would most likely cause some back issues. Compare that to this individual over here who has a little bit more of a straight back, back is flat, core is tight, feet on the ground. You know, that is keeping the vertebral column in a nice straight position. Let's keep going, because maybe your client doesn't want to max out on bench. Maybe they don't want to do those other ones, but they want to work the core. And with the core, we often think of a plank or a push-up. Now, hopefully you can pick out the one that's correct, even though it's labeled. We're starting to see the curvatures. We're starting to pick up on the fact that some things, even though it's a little bit curved, is better than a super curve. As a personal trainer, as a physical therapist, as anyone who's prescribing exercise in proper form, it is your job to pick out those things and to figure out what muscles would correct this. And before I give you the final question, I do got to note that sometimes certain sports, certain yoga requires flexibility, and they can do these things because they've trained their bodies to allow it and to adapt to it. But for most individuals, this back bend is not anywhere near what they're able to accomplish. All right, covering all that, knowing all that, the question for your professional teams is, are these safety signs correct? And when we talk about lifting with your legs, not with your back, what does that mean? And anatomically, is it really true that you should lift with your legs, not with your back? And I've got a few individuals here who are doing some pretty heavy deadlifts. And I think we could all say this is not great form, and they could maybe use the advice of these safety signs while lifting. All right, that is it for the lecture number 7, talking about the vertebral column, neck, back, and the spinal cord. We got a little bit into the back muscles and muscles where you're in the gym working these or in the PT clinic, but we will get to a lot of those later. So thanks for watching, and I'll catch you back in lecture number 8.